unknowns don't just compromise the care I can deliver my patients, they also undermine the fragile doctor-patient trust. It's an unsustainable dynamic. Just tell me how that shows up for you as you are trying to administer care.
Yeah, so I'm part of the healthcare system. I see patients in emergency room. Oftentimes, they are extremely sick, life and death situations. And the last thing they should be worrying about is if they could pay for their care. And recently, I had a man, he was very sick, his heart rate was very slow. I needed to admit him to the hospital. And he beckons me closer, and I thought he was going to ask, am I going to be okay? Am I going to live? But instead, he asked me, is my insurance going to pay for all of my care if I get admitted to the hospital? And I didn't know the answer to that. I didn't even know what his health plan was.
You know, Michael, today is my older daughter's birthday, and so I've been thinking a lot about the day that she was born and how it's the most magical day of my life. And I go in and they're like, okay, we need to see your insurance and your credit card. That's going to be $1,000. And I was like, oh, we got to do some business before we go through the miracle of giving birth.
Yeah, I mean, I've had situations in the care of my mom when we'd had, an emergency and we go take her and someone's going to, before they even get her into the back, who's going to pay for this? What's the insurance? Insurance industry drives, Dr. Yang, our healthcare industry. That's the bottom line. You can prescribe a course of treatment as a physician, with the patient in front of you, with the diagnosis in front of you. You can prescribe that course of treatment, and some bureaucratic insurance operative is sitting there going, no, we ain't paying for that. We're not paying for that. And so that patient's response to you in the moment that, before you committed to care is an important one and an unfortunate one that patients find themselves having to ask, will my insurance cover this? That's the problem. But is the deeper problem the cost in the first place? Why we're spending so much for a bottle of pills? Why patients are spending so much for basic treatment that any place else on the globe they can get either at a significantly reduced cost or for free? What is the balancing act here in our system that's so out of whack that we find ourselves, doctors like yourself, my sister's a doctor, had to stroke a big check as a neonatal doctor before she even saw one patient in the beginning of January to pay for the insurance before she saw a patient. That's the reality for physicians and patients right now.
Yes, exactly. I agree. I mean, I think healthcare prices are through the roof. They're too high. All of these healthcare clinics and hospitals are merging, which gives them more bargaining power. So, yes, I agree. The prices are too high. But I also feel like the insurance industry has made it extremely challenging for doctors like myself to provide the care that patients need.
Simone, can I just connect the dots on both this story and another story that we've been following, which is, RFK's position on vaccines, and specifically some reporting that we saw yesterday from the New York Times about how an attorney who is both helping Kennedy vet other administration officials for HHS has a history of litigation to try to revoke approvals of the polio vaccine, to try to pause 13 other vaccines. One of the concerns that I have heard, Simone, from physicians, and I wonder if you've heard the same, is a concern that if you do not have vaccine mandates, then all of a sudden insurance companies aren't going to want to cover these vaccines. And so when they talk about the fact that, okay, those of you who want vaccines, you'll be able to get them, it is actually more complicated than that, both in terms of the health of the kid who goes to school with my kid who didn't get the vaccine, and in terms of your ability now to pay for the vaccine that you want.
Just on that, can I dovetail on that real quick? The bottom line is, are insurance companies prepared to pay for polio?
No, they're not.
Because that's not in your insurance formula right now, because we covered that. And now you've got the Secretary of Health coming in saying, guess what? We're not going to vaccinate kids for polio. We want to pull that vaccine off the shelf. So when the first polio case shows up, insurance companies, be prepared to pay for it, because you got to figure that out. That's the reality.
Look, I know we have to go, but this is, Dr. Oyen, you are amazing. And this is just such a real conversation for so many people across the country. Pre-Affordable Care Act, the insurance companies were deciding whether or not to cover people based off pre-existing conditions. Being a woman was a pre-existing condition in many respects. Like, if you had had a cancer diagnosis, if you have diabetes, they could have just said, you know what, we're not covering you. So what the Affordable Care Act did was ensure just a basic level of care for people. But the issues that have emerged still within the system are that the coverage is so expensive. And so now you have the administration getting Medicare to negotiate drug prices, capping the cost of insulin, right, for seniors at $35. Those things are important and it matters. But for the rest of the country, there's only so much that this federal government and the Biden administration has been able to do. And now doctors like yourself are out there just, you know, trying to give the people, trying to uphold your oath, give the people the care that they need, yet also fighting the insurance companies. It's remarkably frustrating, and I don't know what people are going to do. I don't know. I know, y'all, this ain't a hopeful note to end on. So, you know what, we're gonna have something else to say after the break, okay? Dr. Helen O. Yang, we love you. Thank you very much. We'll have more folks after the break.